Please join me in wishing all of you a pleasant evening. Imagine that a member of our family has died after contracting COVID-19. Are we going to break down and weep about this? Or blaming others for infecting our own family members with the sickness? Whatever our reaction, death has already taken place, and we have no control over it. However, avoiding mortality is more likely if prevention is implemented from the outset. The global death toll has risen to 5.64 million. The figures of COVID-19 has worried the whole globe. As a result, the Malaysian government, with the assistance of the World Health Organization (WHO), has devised preventative measures to halt the spread of COVID-19. The preventative measure is wearing a mask in public, particularly inside, or even physical separation is impossible. Hands should be washed often. Use soap and water or an alcohol-based hand massage. Practice social distance or self-isolation and a variety of other techniques. Do you know how social isolation, social distancing can help limit the spread of the disease? In layman's words, social distancing is a non-medical infection control strategy, whereas self-quarantine refers to those who have been exposed to the novel coronavirus and are at risk of contracting COVID-19. Both of these recommendations aim to limit the possibility of infected individuals coming into touch with healthy individuals. As a result, this is extremely good in warding off illness. Without self-isolation, the likelihood of this high death rate doubling in a short period of time will quadruple. This is because of the disease contagious nature. It is believed that one diseased individual can infect up to 120 healthy individuals. Therefore, self-isolation has the advantage of limiting an infected individual exposure to a healthy individual. What occurs is that an infected individual must be in a designated location that is isolated from the general population. Beds and toilets that are exclusively for the patient use. According to the World Health Organization (WHO) standards, this is self-isolation should last at least 10 days beginning on the day the patient is tested positive for COVID-19.
Without social distancing, we will cause the spread of virus even more rapidly. If social distancing is done correctly and on a large scale, it helps to break or slow the chain of transmission from person to person. This was clearly proved in the analysis done by University of Washington Health Index and Evaluation Center (IHME) in 2020. Analysis of the epidemic situation in 7 lockdown cities in Wuhan, Italy, and Spain showed that maintaining social distancing really achieved results. Besides, this was also supported by the study done by Erin Mordecai and his team of biologists at Stanford University. They demonstrated the role of social distancing in epidemic control by developing an interactive simulator to simulate the spread of COVID-19 over time. Notably, the government quickly adopted the correct strategy, thus controlling the rate of the increase of cases and winning more time for doctors. If this had not been the case, it would have been impossible for medical staff from another province to go to Wuhan for support, and Wuhan appeared to be the only outbreak city. There were 50,633 confirmed cases in Hubei on February 18, 2020 because of a peak after the closure of the city. Then, the number of cases began to decline. As of April 13, the number of confirmed cases in Hubei province was 244. This again shows the effectiveness of social distancing in controlling the spread of COVID-19. Without social distancing, we may experience shortage of medical supply. The rapidly increased cases of COVID-19 have shown to be overburden the healthcare system in the early stage of the outbreak. Besides, this epidemic situation also delayed the hospitalization of non-COVID-19 patients, especially those who were in critical condition. Studies show that the daily shortage of ICU beds for critical COVID-19 patients remained at the level of 100 beds during the entire first wave of outbreak when the government adopted the social distancing and lockdown strategy. In addition, social distancing also saved medical resources such as masks, hand sanitizers, and alcohol-based disinfectants. Other than the medical costs, we should also focus on healthcare workers who risk their lives and time to help people. Imagine yourself as a healthcare provider or even their family member. They work day to night and sacrifice their rest time for the people who need them. They're eagerly waiting to go home and reunite with their family members. So, stop being selfish and be disciplined so that we can all fight the deadly COVID-19 together. The way novel COVID-19 is transmitted means that taking certain social distance measures is the most effective practice to prevent and control the disease. WHO's Southeast Asia Region Director Poonam Katrapal Singh found that we could reduce the virus transmission by following social distancing measures. The spread of this disaster is global. To fight the epidemic, people from all countries need to unite to see the coming of hope.